Are there blood tests that confirm lupus remission? Have you ever wondered if there are blood tests that can confirm lupus remission? Lupus is a complex autoimmune disease that can affect various organs and systems in the body. When we talk about lupus remission, we mean a state where the disease activity is minimal or absent, and symptoms are well controlled. However, confirming remission is not straightforward due to the nature of the disease. Currently, there are no single blood tests that definitively confirm lupus remission. Instead, healthcare providers assess remission through a combination of clinical evaluations and laboratory tests. These tests help indicate low or absent disease activity, but cannot provide a complete picture on their own. Some common blood tests used to monitor lupus activity include anti-double-stranded DNA antibodies, complement proteins such as C3 and C4, erythrocyte sedimentation rate, and C-reactive protein. In active lupus, levels of anti-double-stranded DNA antibodies often rise, while complement levels drop. If these markers show normalization or stable low levels, it can suggest reduced disease activity. However, this does not confirm remission. Clinical criteria for remission also take into account the absence of symptoms and signs of active inflammation. Healthcare providers look for stable or improved organ function, and whether there is a need for high doses of immunosuppressive medications. Organizations like the European League Against Rheumatism recommend combining clinical assessments with laboratory findings to define remission or low disease activity states. It is important to note that no single biomarker or blood test can fully capture all aspects of lupus activity. The disease can manifest differently in each person, and some symptoms may not be reflected in routine blood tests. Research is ongoing to identify more precise immune markers and advanced tests that might better predict or confirm remission in lupus. Some new therapies aim to reset the immune system, but these are still experimental and not yet standard for confirming remission. In summary, while blood tests are crucial for monitoring lupus activity and can support the assessment of remission, no blood test alone can confirm lupus remission. Determining remission requires a thorough clinical evaluation alongside laboratory findings. Patients should work closely with their healthcare providers to interpret test results in the context of their overall health and symptoms.